Hello, good morning everybody. It's really good to be here this morning. Nice to see so many of your faces from up here. It's great. And thank you for the wave. It was a really good thing to get started at, sort of get some energy in the room and to understand some of the issues and things we're tackling. So my name's John Powell. I'm the Director of Adult Social Services, Health and Wellbeing in the London Borough of Redbridge. And I've been in the people business now for 35 years. I had 20 years in the children's world, as I call it, and I've had 15 years in the adult world. And I think one of the key factors for me about all of this discussion that we're having today is the fact that we need to remember that we put the people at the centre of what we're trying to do. And now for you, those people may be the workforce. But for me, in relation to the work I'm going to talk to you about a little bit, it's more about putting the service users at the centre of that, and then how the people that work within the workforce can adapt and work and change to meet their needs. So I'm going to give you a very brief overview of some of the work that we're doing, and the slides are quite full, so I won't go through them in complete detail. I'll leave them for you to take away. We're working through at the moment a significant change within the local authority and working closely with NELFT, who is our community foundation trust that works across a number of authorities, but including Redbridge. And one of the things that we wanted to do was think about how we could integrate our services and work differently going forwards. And so we've created what's called a HAS and a hub. And I'm going to talk to you about the HAS, but the hub is about working closely together within the authority to have a business hub that includes public health, adult social care, and our leisure and library offer. And that group of people will oversee the work of the HAS. I'm particularly going to talk to you about the HAS today, though, because I think that's quite an interesting part of your agenda and looking at how we developed and worked across that. I'm going to give you a bit of background, but I'm going to skip through most of that because it's familiar to you. Talk about the present model and who, what and where and how we're doing that and what the key features are. So in terms of the Care Act, you all know about the Care Act. That's a significant driver. I have to say that people talk about, well, what's the future of integration? Well, actually in our local patch, and you'll hear more about this when Connor speaks, actually we've been doing integration for a number of years. So we've actually worked on relationships already, and we've got that practice to fall back on. But the Care Act now has provided us with the opportunity to really focus on a number of key things. And the assessment process is at the core of that. So we wanted to think about, well, how can we do assessment differently? How can we work in a different way that enables us to have the eligibility criteria, but at the same time build in a prevention agenda? And also the thinking around the person and the development of personal budgets so that they can be in control. And there are a number of other factors that challenge us around working across local government and health, not least of all the fact that local government and social care can charge for services. So there's some interesting dynamics that the Care Act has introduced, but we have to work through those things. I think the other important factor here, although I'm talking about the service users, there's also the carers and the importance of them and their opportunity now to have a carers assessment through the Care Act. I have to say we've been doing carers assessments in Redbridge for many years, and so this wasn't too much of a shock for us, and we've had a very positive working relationship with carers locally. And I think that's all part of how you can work towards change that will ultimately impact on the workforce as well. So there's a number of things that we want to say, well, why now? So clearly the Care Act has come in and it's given us those new duties, and that's great. We've actually worked on the Health and Social Care Act for some time. We've also built on the success of our Section 75 partnerships already. We've had learning disability and mental health partnerships for some time, and we've got to understand the ways of working between the local authority, the social care workforce and the healthcare workforce. So that was a positive for us that we've got some background to do that. But of course, as been said already, the funding challenge is a significant issue for us as well. So in terms of the HAS, so the Health and Social Services ways of working, one of the key factors for us was that we wanted to make sure that we put people that are going to use that service at the core and at the front of the work that we want to do. And I think it's interesting because we've had many discussions about the people that might be needing the service. And as we've developed the structures and as we've developed the programme, we've ensured that we've reflected upon that. Now, I'm not quite sure why it is the case, but in my slides originally, there should have been a set of pictures at the bottom of these slides that would have shown you the real people that we've been applying to the work that we've been doing. So apologies for them not actually coming out today. But it's just important to emphasise that each piece of the work we've done was reflected back on how will that impact on these particular people. We've wanted to make sure that we've got a clear pathway. We've heard already about the importance of pathways, and we wanted to make sure that people had a single point of access. It was important for us to start to think differently and to think about how we could amalgamate our services within the council with those of NELFT within the community. And the other factor here is we wanted to make sure that assets that we owned, so some of the properties, could be actually managed differently and better for the benefit of the population. Of course, you can't do that without thinking about the staff as well. And I think it's one of the key factors that we've really engaged in with the local workforce, whether it's from health or social care, is that actually building in that respect for each other and their contributions have been valued throughout the process. We've made sure that there's less bureaucracy because delivering a holistic service is important, and we wanted to make sure that we listened to what the various disciplines had to say and helped to develop and mould the way of working going forwards. One of the things that people often say to me is, well, you know, it's a bit risky this, isn't it? And I say, well, actually, my 35 years of people management and working with people is risky. And I think we have to acknowledge that there are risks in everything we do, but if you don't take risks, you won't innovate. You won't do things that are different. You won't take those steps that might be somewhat of a challenge. So we've really encouraged the workforce to talk about, well, what are the risks and how can we mitigate against them? And we also wanted to make sure that the way in which we moved forward was evidence-based and had a clear service development. So you can't see this particularly well, although it's quite a big screen. Yeah, it's quite good. But actually, when you look at this away from today, I hope that you'll be able to see that we've tried to pull together a methodology whereby we actually have people coming into one point of access, we identify their needs, and the issues around cost is that we've got the challenge of pushing people back out into the community with preventative services to help them to help themselves. And that's a big challenge for us. We've got significant financial challenges, and one way of doing that is making sure that we have a good infrastructure, good prevention services, and good alternative options for people about advice and information. However, if people do go through to have a full assessment, what we're moving to is having locality teams where we'll actually send people to the locality. So we won't ping-pong people around. At the moment, we have LD services, we have mental health services, we have physical disability services, we have older people services. And what we're trying to do here is say, we'll put those expertise together, but we're going to work on having a function that is on locality basis. And so we're going to work through a process where we'll have an enhanced service that will look at prevention and early intervention, try to avoid people coming into the system, but if they do need to go out, then they go out to the locality teams. The key factors on all of this for us has been about our workforce. I've took some risks. I put all of my social workers at risk. So everybody within the workforce. Now you might think you're bonkers. You can't get social workers. They're hard to get. Actually, it's been a really interesting and empowering opportunity because what we've said is we've got to change the competencies. We've got to change the way in which we deliver the work that we do. And actually, people have really risen to that. What I've also done is built in a career grade so that people can see there's opportunity. So if they work towards enhancing their competencies, they can improve in terms of their salary and rewards as well. And I think that's been a really interesting period to go through. It's been tough, and actually the workforce element of this has taken a lot of time, but we've put a lot of time and effort into doing that. And I have to say, my colleagues in HR within Redbridge and within NELFT have been extremely helpful in helping us to map that out, be clear about it. But I can actually honestly stand here and say over the last 9 months, it's been a really difficult journey, but we're actually on target, we're hitting our milestones, and more importantly, we're recruiting the right people into the roles going forwards. So who is the HAS? Well, the HAS is the frontline services, so it is all of our social work, it is all of the occupational therapies, it's actually working collaboratively with the NHS and NELFT and bringing together the frontline services there from the memory clinic, from palliative care, and the various nursing services that we all know about. And that group has been represented in looking at the pathway. So that's been a really key factor here. So we've been able to build on our experience through the time that we've had Section 75 agreements. We've been able to focus specifically on the people that are going to use our service. And we've been able to look at how we can best fit and design our structures that means we can go on a journey that continues to integrate. One of the significant factors about the locality teams is that they're actually based around the localities of our GPs. And already we're engaging with a number of the GPs and federations who are actually very excited about having social workers and nursing staff in a locality that they can work closely together with. I think there is a really important passion about this. The workforce has to be encouraged to have a passion for doing things better, and we do need to work in a collaborative and a comprehensive way. Clearly, governance is important, and we've built that into the Section 75, and we are beginning to see that people proactively want to work together. So some key factors really as I sort of conclude in terms of the process. So here's an example of one of those people that would have been on the back. I'm not going to talk about Peter in this context, but just to show you that these are the people that we've actually been working with and thinking about in relation to the coming together of this structure. Now that took time to sit down and say, okay, we think this is the design, how does it fit for these individuals? So the key headlines for me, it's about building on a positive experience, having very honest relationships and establish trust to fully integrate. It's about engaging the right professionals at the start, so gaining their ownership, demonstrating a can-do approach. It's about using service user case studies to sense check and co-produce the new service and encourage challenge. It's about workforce engagement events and regularly providing information sharing using the media and various other different channels that we have to share the information with our staff and with our public. And most importantly, it's about delivering on time. People have been looking at us saying, there's no way you're going to do this by the 1st of April. Well, actually, at the moment, my view would be, yes, we are. And I say at the moment because you don't know what will happen in the next 6 weeks to 8 weeks, but actually things are on target, we're hitting plan, and people are collaboratively working very closely to make that happen. So I hope you get a sense of the energy around what we're trying to do in a small part of London in the east, but actually it builds on the work that Connor, I'm sure, will touch on shortly around the way we collaboratively work in our patch already. So thank you for giving me the opportunity to share something about what we're doing in the locality, something about the ways in which we've tried to tackle that, and something about ensuring that we have the workforce engaged, but more importantly, have the right competencies, right skills to deliver the service to the people of Redbridge that is the most important thing from all of our points of view. Thank you very much.